The urinary system is used to get rid of waste by filtering blood. The main organs include two kidneys and one urinary bladder. These are connected by two ureters, one for each kidney, and the urethra brings the urine to the outside of the body. After the body gets the nutrients it needs, waste is left over, and waste left in the blood is called urea. It is carried to the kidneys where it is then removed with other waste and water in the form of urine. Kidneys are also responsible for regulating the acid-base balance, conserving fluids, regulating blood pressure, and regulating the production of erythropoietin. Each kidney contains many nephrons. These are units that filter urine from the blood. Urine then uses the ureters to travel to the urinary bladder where it is stored. There are two sphincters that help to keep the urine in the bladder until it is time to empty it. Nerves from the bladder alert the person when it needs to be emptied, and the bladder contracts and flattens to release urine through the urethra. Kidney stones are hard deposits of salt and minerals that form in the kidneys. They may also form when urine is concentrated and minerals crystallize and stick together. Kidney stones usually form in the renal tubule and can block the flow of urine. Any part of the urinary tract can be affected by kidney stones. There are a few different types of stones. Cystine stones appear when the kidneys excrete too much of a specific amino acid. These occur in people with cystinuria, which is a hereditary disorder. Struvite stones develop in response to urinary tract infection. These can grow quickly with little warning. Uric acid stones form when someone loses too much fluid. This could be because of malabsorption, diabetes, chronic diarrhea, metabolic syndrome, or high protein diets. Genetic factors could also increase the risk of uric acid stones. Calcium stones are the most common kidney stones. These are typically in the form of calcium oxalate, which is a substance that is made by the liver or absorbed from one's diet. If the stone is in the form of calcium phosphate, it could be from metabolic conditions like renal tubular acidosis. It could also be from medications that treat seizures or migraines. Pain is not usually felt until the kidney stone moves, and signs and symptoms include nausea and vomiting. Also, pink, red, or brown urine and cloudy or foul-smelling urine. It is also common that people with kidney stones will need to urinate frequently, but will not be able to fully empty their bladder. If the kidney stone moves to a ureter, it may block the urine, causing a backflow of urine. The ureter to spasm and the kidney to swell. If this is the case, then symptoms may include pain that fluctuates in intensity and radiates to the lower abdomen or groin. Severe sharp below the ribs and the side and back, and pain or burning sensation when urinating. Pain can also shift or change in intensity while it travels through the urinary tract. If someone is dealing with small kidney stones, those will pass eventually, and they can be strained from the urine to be analyzed. If it is a large stone, then something may need to be done to help break it up before it can be passed. This could include using drugs to partially dissolve the stone. Other methods of fragmentation of larger stones include using sound waves, which is extracorporeal shockwave lithotripsy, or using a ureteroscope and a scope-mounted laser lithotripsy. In extreme cases, surgery may be used, called percutaneous nephrolithotomy.